Mother.
Father.
Aunt.
Cousin.
Brother. Friend.
Son.
Breast cancer affects both women and men of all ages. Statistics show that about 1 in 8 U.S. women will develop invasive breast cancer over the course of their lifetime. About 2,360 new cases of invasive breast cancer were expected to be diagnosed in men in 2014.
My name is Suzanne Nolan. I'm the clinical coordinator here at Western Tech for the PTA program, and I'm a 4-year breast cancer survivor. I was first diagnosed when I was 41 years old. I didn't have any type of history, breast cancer history or cancer history in my family. When I was diagnosed, I noticed a cyst in my breast, and I had a mammogram, and it came back normal. And over the next 6 months, it started to harden around that area. And I kind of ignored it and self-diagnosed myself that it was just fibrotic changes in my breast. And when my yearly mammogram came up again, I told the doctor, and he's like, no, we definitely need to take a look at that. And so sure enough, after my mammogram, they diagnosed me with what's called DCIS, which is a non-invasive form of cancer, but I ended up having to have a mastectomy and chose to have both sides taken off. 3 days after my mastectomy, my pathology reports came back, and they found a second cancer in the tissue called HER2, which is a much more aggressive cancer. So everything from that point on changed for me, because now I had to have chemo and radiation. I chose to have reconstruction surgery, so that had to be delayed because of the radiation. I ended up with an infection after my mastectomy, which also delayed some of my reconstruction surgery. But once I went through 6 months of chemo and 36 radiation treatments, and 2 years after that, I finished up with all my reconstruction surgery and am on a clean bill of health since then, and been able to enjoy my lifestyle again with my kids and everything. My family was a great support for me, along with my children, because it doesn't just affect you, it affects your whole family. And so we all made it through together, and so I'm here to tell be able to tell my story and hopefully help other people that are just starting their journey through this whole process. My tips for women is get to know your breasts. They go through changes throughout the month through your cycles. You need to understand those changes. And if you have any doubts about what you're feeling, always go and ask your doctor. Don't put it off. Don't try to self-diagnose yourself like I did. Always go in and check. And if you're not satisfied with your results, just keep pressing and keep pressing, because there are times where they do find lumps where they weren't able to find them on the mammogram. They had to use ultrasound. So just keep checking and keep on your doctor, and that's the best mode of detection, is that self-detection.